Volkswagen Touareg Sabbatical Initiative asked South Africans to share their ideas of how they would put the luxury of time to good use with a sabbatical dedicated to making a difference. Dr. Rufaro Nyamuda was announced as that successful applicant of the campaign. She created a comprehensive and robust healthcare management and educational app which promotes the optimal medical support of children from grade 0 to grade 12. Dr. Rufaro joins us now in studio to discuss her 3-month-long quest to putting first aid care in the hands of South African children. Good afternoon, Doc, and thank you so much for joining us on the SABC News Desk.
Thank you so much for having me.
Well, congratulations are in order. There were more than 1,300 applicants and you came out on top. Tell us what drew you to the competition in the first place.
Well, what actually drew me to the competition was they had a tagline that said, "For the restless spirit." So they were looking for a young working professional who had an idea that they wanted to better society, and someone who had a vision and they knew that they could make a difference. And so a friend of mine actually sent me the link. I think I was probably one of the last applicants, just made it in the nick of time. And it sounded like such a wonderful opportunity to give you the luxury of time, a 3-month paid sabbatical, where you could explore this idea that you had.
Yes. And what was that idea? I just want to get I want to get a sense of how you conceptualized that idea, or how you brainstormed, and the vision you had. Did it meet your expectations when it all came to fruition?
So the reason I applied for the sabbatical, the reason behind the app, actually came to me when I was working in emergency departments. I've worked both in private and public practice, and I realized that we spend a lot of time educating adults and caregivers on how to keep children safe, and not much attention has been paid to actually educating children on how to keep themselves and others safe when they're faced with an emergency. So you find that, parents would bring in their child and something would happen and they'd feel so guilty. They'd be like, "We just turned our back around for 2 minutes and something happened." We're forgetting that children are actually more than competent to learn basic skills that could actually make a difference when they need to. So then the idea actually started with, how do we create a basic first aid platform that would allow us to educate children from as young as 5 years old. Basic things like, what does funny breathing sound like? So they notice if their friend's breath and breathing sounds different, that should alert them to call a teacher or an adult. Things like, how do we manage basic cuts and scrapes? What should we do if something abnormal happens? That they also feel empowered that they can actually take action. So I took this idea to schools, and what we realized was that it would work incredibly well if we introduced it to schools, so that it formed part of curriculum, but also that we needed to provide more support for teachers. So most schools can only afford to send 1 or 2 staff members to occupational health and safety training. We're quite resource deprived in South Africa, so why not create something that would also allow us to increase the number of staff members who also had access to first aid training.
How is the app being received by the education sector right now, and schools in general?
Very
What's been
positive.
the response?
So we've been quite lucky that the response has been overwhelmingly positive, and this is from parents and from staff at schools. We approached the Department of Education in the Eastern Cape, and they were incredibly excited about it, and they'd like to see us roll this out into their schools in the province. So we'll be starting in the Eastern Cape when we start to roll out the program. But I've been incredibly fortunate. I don't think a single school has said no to me, and everyone has just seen the positive value in having such a product in schools.
There was a tremendous focus on children and how to keep themselves safe, and as you traveled, you spoke to people on the ground. What did you garner about the challenges people in deep rural areas face when it comes to keeping children safe and healthcare in general, Doctor?
So the reason that we decided for the 3-month sabbatical to travel the country was I wanted to see what the barriers for entry were in different communities. So it makes, the assumption is that in some communities where there higher LSM groups where they can afford to pay for the service, that it would be easier to implement. That was the assumption. And in poorer communities or previously disadvantaged communities, that we would have far more barriers to entry. And I found that across the board, things like language barriers, so it's incredibly important to make sure that the app is easy to understand in a language that's your primary language. So to make sure we do it in Afrikaans and English and Xhosa and Zulu, in all our official languages, because when you're learning something as important as first aid, you really need to understand it.
Yes.
Another barrier was obviously cost, because an app, to download it and the content that we'd be sharing, it's quite costly. So we've engaged with some service providers, network service providers, to ask if they would zero rate the app to make it affordable and free in some communities, and they've agreed to do so, which is wonderful. So we know that most communities in our country can afford it.
All right. Now, one of the big features I read you added to this particular app was teenage mental health and well-being. What spurred your focus there, and how does this particular feature work, Doctor?
So the idea to add that that additional feature for mental well-being came from schools, and pretty much every school I spoke to had asked me, are you doing something to address mental well-being for our learners? Health and safety is important, but we've also found that the number of children who are on antidepressants, the number of children taking serious medication during the school day has increased, and they wanted to see if we could address this. So what we basically allow learners to do is to report things like bullying and abuse anonymously, and we pick this information up in the app, and we're able to go to schools and say, your grade 9 learners are reporting abuse the most, I think you should intervene and speak with them. But it allows us to highlight certain areas that schools may not be aware of. How prevalent is depression in your school? How anxious are your learners? How does this affect with their learning? And if the school can actually do something to help. So a number of the schools, again across the board, from private wealthy schools to our rural schools, all came back with this be a wonderful feature for us to add, and that's why I decided to do it.
Your advice to somebody out there listening who'd want to undertake a similar endeavor, maybe not in the medical fraternity though?
Regarding mental well-being, so what was also quite interesting is I've been allowed to present the app in a few platforms. So when we had the launch, and I had a few adults actually approach me afterwards and asked if I was doing something similar for corporates. And they felt that it was wonderful to start with learners and children because they are at risk, but also to focus on adults because they also struggle with things like mental care and mental well-being. So we have ideas to do that down the line, but if there's someone who's in a better position right now that they feel they could tackle mental well-being in a corporate workspace, I applaud them, and I think they should definitely look at something in that space.
Dr. Rufaro, thank you so much for sharing your insights with us right here on the SABC News Desk.
Thank you so much for having me. It was a lovely interview.